Om Swastiastu, Assalamualaikum warahmatullahi wabarakatuh. Shalom, Namo Buddhaya, may peace be upon us all. We are SGD B7 are going to do a presentation about our student project titled ISOSPORA. And here our group members.
Let me introduce myself first. My name is Stella Angeline Isbianto and my last three digits are 142. And now I will present about our background information. There are a lot of diseases that have been found in the world, including parasitic diseases. The definition of parasitic diseases are any illness that is caused or transmitted by parasites. Parasitic diseases usually caused by contaminated food, water, or bug bites. Parasitic diseases are something we have to consider seriously, especially on prevention because there are no vaccines currently available for parasitic diseases in humans commercially, even though there is evidence of acquired immunity and resistance to reinfection in most of the parasitic infections in some trials. There are so many parasites that cause diseases in humans, and one of them is ISOSPORA SPP, which has worldwide distribution and more common in tropical and subtropical areas.
My name is Gusti Rahadi Aryawangsa, and my last three-digit number is 144. So I will explain about the problem foundation of this topic. So the problems are: what is the taxonomy, characteristic, life cycle, epidemiology, pathogenesis, symptoms, risk factors, and diagnosis of Isospora belli? What is the laboratory diagnosis of Isospora belli? What are the relations of Isospora belli infection and HIV or AIDS? And how to treat and prevent Isospora belli infection. Next, the objectives are to understand all the problems that I mentioned before. Next, the benefits of this paper for writers is to increase and deepen the author knowledge of Isospora belli and to gain abilities in searching for literature and an increase in critical thinking abilities. And benefits for readers is to expand and deepen knowledge related to Isospora belli and to get knowledge of the diagnosis, treatment, and prevention of Isospora belli infection.
Let me introduce myself. My name is Valerie with the last three-digit number 143, and in this presentation I'm going to present about the general characteristics of Isospora belli. Isospora belli, now known as Isospora belli, is an obligate intracellular parasite. In detail, Isospora belli is a protozoa that is shaped like a cocky and are found mostly in tropics and subtropics places. Their oocytes are shaped like ellipse and are elongated with a dimension of 20 × 19 micrometer. Isospora belli belongs to the genus Isospora, family Sarcosistidae, suborder Eumeriorina, order Eucoccidiorida, and phylum Apicomplexa. That's all from me. Thank you.
Let me introduce myself. My name is Mulya with last three-digit numbers 151. Here I would like to present the life cycle of the Isospora belli. The life cycle of Isospora belli starts when humans swallow the food and water that is contaminated with stool, which contains all stages of the sporulated oocyst. Once the mature sporulated oocyst has entered the human body by gastrointestinal tract, in this case its small intestine, the sporocytes will release a sporozoid. This is the way infection of Isospora belli occurs and begins to disrupt the epithelial cells of small intestinal wall. In the intestinal epithelium, the sporozoid differentiates into tropozoites and reproduces itself by asexually called schizogonia and produces two merozoites per each and disrupt the adjacent cells of small intestine epithelium. Meanwhile, the tropozoites undergo two different pathways. The first one is sexual cycle or gametogeny that produces macrogametocytes and macrogametocytes and then secretes immature oocysts in process and develop to mature stage in cell. And the second one is the dormant cysts or hypnozoites in extraintestinal tissues. The cycle will keep continuously repeating as long as the humans keep the oocysts contaminated with and water. That's all from me. Thank you.
The next topic will be presented by me, Agyaputri with the last three-digit number 155, epidemiology. The first case of human infection caused by ISOSPORA belli was found in 1915. At the time, it was believed that ISOSPORA belli only infected humans. And ISOSPORA belli disease is distinctly rare among immunocompetent people. That's why it is commonly found in persons with AIDS. 0.2 to 3% of still positive for ISOSPORA belli. In addition, ISOSPORA belli has also been positive found in patients with leukemia, lymphoma, and recipients of kidney and liver transplants. ISOSPORA belli infection was discovered by travelers who came from endemic countries such as the Caribbean islands, Australia, Latin America, Africa, and Southeast Asia. It has been reported to be implicated in travelers' diarrhea in endemic areas.
Okay, hello, my name is Bryan Tjandra with the last three digit name 152, and I will explain about pathogenesis. So there are five parts. The first part is ingested mature C. belli oocyst will release sporocytes, and it will invade the enterocyte starting from the proximal duodenum that causes diarrhea, and then it will transform and multiply through schizogony. And one of the most important part is during this reproduction process, the clinical manifestation such as malabsorption, weight loss, abdominal pain, non-bloody diarrhea, etc. will occur.
Okay, before I continue, let me introduce myself. My name is Marina with the last two digit number 140. After they transform and multiply, they will invade other cells. And after they invade other cells, they will do a sexual multiplication or sporangea occurs. Producing oocytes, they will spread in the entire system. The oocytes outside the host matures and be in infection stage 2 until 3 days after. These oocytes tends to be resistant and active for months. That's all for me. Thank you.
Okay, before I continue to the clinical manifestations, let me introduce myself. My name is Dantia Widarta, with my last three digit number being 147. Next slide. Okay, the symptoms of infection by cystoisospora belli can be a profuse and watery diarrhea, fatty stools, also can be called steatorrhea, abdominal discomfort, fever, nausea, anorexia, and also a severe weight loss. In immunocompromised patients, the symptoms are also present, but is more severe and longer lasting. Next slide. The diagnosis can be done by a microscopic examination, which use a concentration method and a direct fecal smears. The diagnosis can also be done by a molecular examination, which use a real-time PCR assays. Next slide. Risk factors. In some epidemic outbreaks, the oocysts of cystoisospora belli can be found in an industrial water treatment plant, possibly contaminating the vegetable. Some research also shows that consumption of unwashed fruits and vegetables is highly associated with the infection of cystoisospora belli. Next slide.
First of all, let me introduce myself. I'm Anastasia Andreatamberius with the last three digit numbers 154. In here, I'm going to explain the laboratory diagnosis of ISOSPORA belli. Diagnosis of ISOSPORA belli is achieved by the detection of the oocysts present in stool samples. Universal precaution should be performed when examining fresh stool samples. The method starts with macroscopic stool characteristics such as consistency, presence of blood and or mucus, segments or adult parasites, followed by microscopic examination. Cystoisospora belli are acid-fast parasites. Their oocysts can be distinguished with saline wet mount and visualized after improved acid-fast staining. This is possible because of their large elliptical size. They also stain positive using the auramine-rhodamine technique, GIMSA staining, lactophenol cotton blue staining, and the heated saffron methylene blue technique. In non-HIV infected individuals, peripheral eosinophilia is present as Charcot-Leyden crystals in the stool. Leukocytes of fecal are usually not seen. When a fluorescent microscope is used to examine stool smears after auramine-rhodamine staining, sporont fluoresce green. A real-time polymerase chain reaction or PCR's assays have been developed and used to detect I-belly in research labs. Thank you.
First, allow me to introduce myself. My name is Carla of Manullang with my last three digits are 146. Now, I want to present about ISOSPORA belli on HIV/AIDS. In patients infected with HIV in the tropics and subtropics, ISOSPORA belli is often found. One of the intestinal opportunistic infections associated with HIV/AIDS is isosporiasis. The progressive decline in immune status will cause HIV-infected patients to become susceptible to virus infections, both general and opportunistic. This parasite develops in enterocytes and is excreted in the feces and is transmitted by the fecal oral route through contaminated water or food or direct contact with infected animals or humans. HIV-infected individuals are more likely to experience sudden, severe, and explosive diarrhea when infected with opportunistic protozoa. Patients are at great risk for ISOSPORA belli infection if they do not have a clear and adequate response to antiretroviral therapy. Thank you.
My name is Anjani Prabandani Sudewa with last 3 digit 148. So I will explain about the treatment of ISOSPORA belli infection. Patient diagnosis with ISOSPORA belli infection with enteritis or with exceptional extraintestinal involvement can take oral cotrimazole 160 mg trimethoprim or 800 mg sulfamethoxazole as the first choice. The drug can be given 4 times a day for 10 days or twice a day for 7 until 10 days. The consumption of trimethoprim sulfamethoxazole to patients infected with ISOSPORA belli is the most effective treatment, but the immunocompetent patients who are infected usually recover on their own and do not require any treatment. Patients with HIV infection usually require longer treatment, and alternative treatment options that could be used were pyrimethamine 50 until 75 mg per day along with folinic acid 10 until 25 mg per day, or ciprofloxacin 500 mg twice daily for 7 days and followed by suppressive therapy 3 times per week. And as a reminder, the consumption of cotrimazole can be adjusted according to the severity patient respond, and if necessary, electrolyte supplement can be given. Thank you.
Next, let me introduce myself. My name is Leonyta Augustyne with the last 3 digits number 150. As explained above, ISOSPORA belli has unusually a complicated stage before infecting the host. This parasite attacks the deep epithelium of small intestine, causing diseases such as diarrhea and cystoisosporiasis in the human body. Scientists nowadays have figured that cystoisosporiasis spread to our digestive systems, which means it is affected by everything that we consumed. Therefore, the prevention of ISOSPORA belli cycle and infective stage is the application of hygienic measures practiced daily, such as hand washing with soap and warm water regularly, hygienic eating tools, sterilizing outside food. These acts of prevention are meant to minimize contact or more avoiding food or water that might be contaminated because cystosporiasis and diarrhea both are proven foodborne and waterborne illness. After infected ISOSPORA belli, this parasite cannot automatically harmful since it must through the mature stage for about 1 until 2 days. During mature stage, the parasite sometimes shed the immature form through feces. Therefore, it is suggested that during these days, people avoid contact with feces or urine from any living creature. That is all from me. Thank you.
Good afternoon, everyone. My name is Febriano Di Prawira with the last 3 digits number of 156. And today I'm going to give the conclusion to our presentation. The conclusion is ISOSPORA belli is an obligate intracellular parasite that is shaped like a coccus. They have an ellipse and elongated shaped oocyst. ISOSPORA belli life cycle starts from sporulate oocyst, which will release sporozoites. These sporozoites will differentiate into tropozoites, and these tropozoites will reproduce asexually in a process called zygogamy to produce merozoites. Some of these tropozoites will also reproduce sexually, which will create microgametes and macrogametes. The first case of ISOSPORA belli infection was discovered in 1915. ISOSPORA belli infection is commonly found in immunocompromised patients. The pathogenesis of ISOSPORA belli starts with the release of sporozoites. This will cause diarrhea. These sporozoites will then differentiate into tropozoites and perform zygogamy. This process will cause malabsorption, weight loss, abdominal pain, and non-body diarrhea to occur. Symptoms of ISOSPORA belli infection are as follows: watery diarrhea, fatty stools, abdominal discomfort, fever, nausea, anorexia, and severe weight loss. In immunocompromised patients, these symptoms are more severe and longer lasting. Diagnosis of ISOSPORA belli infection is by the detection of oocysts in the stool or bile samples. Risk factor of ISOSPORA belli infection is the consumption of unwashed fruits and vegetables. HIV-infected patients that are also infected by ISOSPORA belli tend to show more severe and explosive diarrhea. Anti-ISOSPORA belli treatment is used to control the symptoms, but once the treatment stops, the symptoms will usually return. Because of that, patients with AIDS that are not undergoing antiretroviral therapy are given drugs to prevent ISOSPORA belli infection to occur. Patients that are infected with ISOSPORA belli are given cotrimazole as their first choice of treatment. On the other hand, HIV-infected patients require an alternative and long-term treatment plan. The treatment options are pyrimethamine with folinic acid or ciprofloxacin followed by suppressive therapy 3 times a week. The prevention of ISOSPORA belli infection can be achieved by applying hygienic measures in our daily lives. Next, I'm going to give some advice. The advice is as follows. ISOSPORA belli infection occurs because of the lack of hygiene in our daily lives. Because of that, we shall do preventive measures to avoid getting infected. These preventive measures include washing our hands, using hygienic eating tools, and sterilizing outside foods and drinks.
That's all from us. Thank you for listening and have a great day.